Now at 7:36, anxiety among children has gone up during the pandemic, and parents want to know how they can help. Coming up, what about hypnosis? Find out why it might be a new option. Well, you've probably been to a show where a hypnotist comedian makes people cluck like a chicken or hop around like a bunny. But more and more, clinical hypnosis is being used to help treat things like anxiety and in kids. Dr. Anbar, the author of the book called Changing Children's Lives with Hypnosis, is joining us right now. You know, this is becoming more common, or is it relatively new for treating children? Dr. Anbar, tell us what this is all about.
And good morning. So children can use hypnosis to help change their mindset. So when, for example, kids become anxious, they can learn to think differently and they can calm down. And I should tell you, all hypnosis is self-hypnosis. It's not what you see in the shows. When you're doing hypnosis, you're in control of yourself.
Oh, that was my next question. Are you saying you're getting very sleepy, very sleepy? So kind of explain that process more.
Well, I don't even own a watch. So the simple process is to teach a child to think about something comfortable, something they enjoy doing, and using all of their senses as they think about it. And that helps shift their mindset, and then they feel better.
So think positive can produce positive thoughts. What other conditions can hypnosis help treat?
Well, hypnosis can help treat anything that the mind is involved in, and that's a lot of things. So in children, it can help with headaches, with stomach aches, with chest pain, with anxiety, with depression, with bedwetting. There's a lot of things that the mind can control, much more than we realize.
And there's something to say about hypnotizing children. They're supposedly easier, they accept it more.
That's right. So children don't have the same misconceptions about hypnosis. They may not have seen the Hollywood movies that portray hypnosis as evil, which it's not. And children also have fewer problems that may have contributed to problems that they developed.
And Dr. Anbar, what ages are we talking about? Who can we try this on?
You can start as young as 3.
Wow.
And as old as 85 if you want to be an older child.
And does it have to be a child with a certain sort of personality that will sit still? Because I know a lot of kids, you can't even get them to sit still for a television show, let alone hypnosis.
Well, you don't have to sit still. You can run around the room and still get good benefit. The main key is that the child should be invested in helping themselves. So when a teenager or an elementary school child, they really have to be engaged in wanting to help themselves. And a preschool child, the parent can help motivate them.
So I know you have the book about hypnotizing children. How did you get into this? How did you figure out that this is something that does work in young people?
Well, I'm a pediatric pulmonologist, a lung specialist, and I encountered a patient with asthma and very bad allergies, and he actually developed asthma attacks by thinking about cheeseburgers because he was allergic to milk products. And when I said, wait a minute, if you can use your imagination to make yourself ill, can you use your imagination to improve how you feel? And that's hypnosis.
Okay, one last question. We're potty training a 2-year-old. Can we use hypnosis to assist us with that?
You can. You can give them some Play-Doh to play with and suggest that by playing with the Play-Doh, they're teaching their body how to deal with their potty training problems.
I just got Play-Doh. Thank you for that. This was a kismic moment. Thank you for that, doctor.
You're so welcome. Thank you for having me.